Welcome to Hughes Knows Nursing. I am Veronica Hughes, and we are going to do a case study today on our series on acid-base imbalance. And this one is particularly about respiratory alkalosis. So if you remember, respiratory alkalosis, you're going to have a CO2 level that is going to be trending down, respiratory opposite, and you're going to have a pH level that's trending up. So something greater than 7.45. So respiratory is the cause. You have the shift happening in the CO2 level, and then alkalosis, meaning that your pH is going up. So let's discuss the situation where this might be the case, how we might kind of come to that conclusion, and then maybe some other disorders that could contribute to somebody having a respiratory alkalosis. So we've got our friend Marty. He is 18, he presents to the ER, he is hysterical, having a panic attack, is complaining of chest pain and shortness of breath, just saying it came on suddenly, he's just bawling, very inconsolable, okay? So that's our friend Marty, okay? So blood pressure is 150/97, so high, low, or normal. That's high, right? So hypertensive. Heart rate of 104. So if you can picture this person in your head, are we surprised that they have a heart rate of 104? No, they're having a bad day, okay? Respiratory rate of 38. Significant, right? Normal people don't breathe 38 breaths per minute. That's very, very quick. So important to note that respiratory rate because we're talking about a respiratory alkalosis, right? And then O2 sat of 96. So not terrible, not great, not 100 or 98, a little bit low. Lung sounds are clear. So there's no indication that we have some kind of lung issue besides that respiratory rate that's super fast, okay? And you got to think about what is happening if I am breathing that rapidly. Every time I exhale, what am I exhaling? CO2, right? So if I'm breathing 38 breaths per minute, I'm going to be offloading my CO2 quicker than I should. So remember, as my CO2 goes down, it's going to make my pH go up because respiratory opposite. So we're going to have a respiratory alkalosis here. All right, so it's the hyperventilation that's causing this acid-base imbalance in this particular case. Would we expect any compensation for this type of acid-base imbalance? So remember, it takes the renal system days to really catch up and start doing anything to alter this acid-base imbalance. And if it really was a panic attack, sudden onset, there's not time to compensate for that. The respiratory system kicks on and can run away with the train before you have a chance to kind of catch up. So I'm going to blow off CO2 really quick. So I'm not going to have a chance for my kidneys to do anything, okay? Okay, we talked about all of those things. ABGs. So let's start at the top. So that pH, remember I'm offloading CO2, so I'm going to expect that pH to be greater than 7.45, or at least trending to the top of that end. But of course, these are all going to be abnormal because that's what we're talking about it. So we would expect it to be greater than 7.45. It's not going to be an acidosis because I'm not retaining CO2, I'm blowing it off. So conversely, my CO2 level is going to be below 35 because I'm getting rid of it. So it wouldn't be between that range of 35 to 45, it would be below 35. And then my bicarb level, or my HCO3, we wouldn't expect any change in that bicarb level because there hasn't had an opportunity for the body to compensate yet. So high pH, low CO2, and normal bicarb. Okay, so if this is how our patient presents with, I have chest pain and shortness of breath, panic attack type symptoms, we would probably do an EKG just to cover our bases. But it sounds like the presentation is of a panic attack. So treat the anxiety, right? Do we need to give them some Ativan to help calm them down? We could coach them on how to start slowing their breathing down. So there's lots of excellent breathing techniques out there, like box breathing. You breathe in for 4, you hold for 4, you breathe out for 4, you hold for 4. So kind of walking them through those types of exercises to help at least regain some control over that respiratory rate. And then breathing in a paper bag, I guess it's controversial now. I guess the evidence maybe doesn't support this, but personal example, I was in labor. I was doing an unmedicated natural birth, and I started hyperventilating because turns out it's like a whole painful thing. So my lips started to tingle and be numb. My fingers were numb and tingly as well. And they were like, "You're hyperventilating." I'm like, "No, duh." Anyways, they gave me a paper bag to breathe and rebreathe. The idea is that you're breathing back in some of that exhaled CO2. Does it work? I don't know. But you might see that on the wide world as something that you would do to help, or just seeing in a book somewhere or whatever. That's what they're talking about. Okay, so respiratory alkalosis is caused by not enough CO2. So remember, with acidosis, we had too much CO2. So we were either not exchanging gas, or we weren't able to blow off our CO2 like we needed to. In this case, we're getting rid of too much of it. So it's the opposite problem. So it can be caused by hypoxemia from pulmonary disorders. So things like asphyxiation could be one, shock, or early asthma, or early pneumonia, where you've upped that respiratory rate in an effort to get more oxygen. So there's an underlying issue with pneumonia. All your alveoli are all gooed up, right? Asthma, your airways are closing off, so you're not getting good oxygenation because of those airways narrowing. So the respiratory rate will increase in an effort to oxygenate better. Okay, so those folks can experience a respiratory or alkalosis. Also hyperventilation, in like the example that we just talked about. So if they have anxiety is a big one. Another one is uncontrolled pain. So if you've got somebody who is scared to death to take pain medicine, they're trying to muscle through it, or if we forgot to give it or didn't get there in time or whatever, and they're breathing quickly because they're experiencing significant pain, that can cause hyperventilation, which can then lead to this problem. So, two main modalities: hypoxemia, so the low blood O2, from things like asphyxiation, shock, asthma, pneumonia, early, okay, or hyperventilation, different ways that you can have somebody hyperventilate: pain, panic, labor. Yeah, so that is respiratory alkalosis.